Let's talk about Maslow's hierarchy of needs. If you're new here, hello, hi, welcome. My name is Judith. I'm an ICU nurse and an F&P student, but I also TA fundamentals of nursing. And I think Maslow's hierarchy of need is a tool that we don't use enough. Fundamentals is essentially the beginning of you learning how to think like a nurse and critically think and have clinical judgment. The one thing all nurses and nursing students remember are your ABCs, right? Airway, breathing, circulation in that order, and then you have pain as that other vital sign. In order to integrate a more thorough clinical judgment, Maslow's is really the way to look because it thinks through all the possibilities of a patient's need and you are the one who puts it in order. For example, if I have a patient and they look uncomfortable, but their vitals look good, and they're looking uncomfortable because they have urinary retention, but they're also really anxious because they're about to have surgery. Perhaps intuitively and just as a nurse, you want to have your next step be to reassure the patient. However, based on Maslow's hierarchy of needs, you actually have to manage the urinary retention first because physical needs supersede any safety or emotional concerns. Learning this hierarchy and what each hierarchy entails is actually the way for you to develop your clinical judgment.